We're back here on Jones and Company today, speaking with the newest medical doctors in our country, 5 of them today. And at the break, Dr. Holly Nixon and Dr. Krista Nottage, you both were supposed to give me your take on, or your perception on the delivery of healthcare in the country today.
Like all health institutions, there's always room for improvement. There will always be the issue of affordable health care and resources that are available to patients who seek medical attention. For the most part, I must agree with Dr. Knowles. The healthcare delivery here is exceptional, but there are still room for improvement.
Mm-hmm.
I would have to agree. Having spoken after my 2 colleagues, I agree with what they say. I do think that we have one of the flagship institutions in the region, and that's just because, having spoken with my colleagues from Barbados and Trinidad and Jamaica, they're clamoring to come and work at the Princess Margaret Hospital. I know that our citizens may be surprised at that fact, but our institution is used as an example to others in the region because we are ahead in the equipment that we have, the facilities that we offer, even though we are still largely strained by numbers. We have a lot of patients, very little space. Of course, we have the new critical care block that's going to be opened, which will assist somewhat in the overflow that we're experiencing at Princess Margaret. Of course, Holly and I have only been there for 2 years, but these are the things that we've observed. And I think anywhere, healthcare systems will be overburdened, especially with growing populations and developing populations as ours is. However, I think that we're doing a good job at kind of stemming the flow right now and trying to manage. We do have doctors graduating every year, and I guess as well as lawyers, it seems like we're overflowing with doctors and lawyers. But the hospital is still in need. And as you said, our peripheral clinics are still in need of assistance. Not just doctors, there are pharmacists needed, there are more nurses needed. So if you're out there and you want to do medicine or you want to be a part of the healthcare field, we're encouraging you to do so because you are still needed. We don't have our maximum yet.
You don't have your maximum yet, eh? But you think you people would wish to give your services to our citizens who live in the various family islands of the Bahamas. A whole lot of young people come back home. They graduate from medicine, schools of medicine, and they want to stay at Princess Margaret Hospital or go into some private practice here in New Providence or Grand Bahama. But there are some islands in the Bahamas that would need your service. What do you think?
You're quite correct, Mr. Jones. What I do think for my field, for obstetrics and gynecology, I think it's much needed in the peripheral islands because a lot of the patients, particularly our antenatal patients, they can only get limited care on the island, and then they have to transfer in the latter part of the pregnancy, you know, to finish their care here. And I think if more institutions were built on the different family islands, I would definitely be willing to help the people there, you know, because it's much needed. Like Dr. Nottage said, if we can have some other institutions, some other hospitals, clinics built on the other islands, it will stem the flow of the persons coming into the Princess Margaret Hospital. And I think that'll make it a lot easier for the physicians and also for the patients that come and get their care.
Yeah. Okay.
Myself and every doctor that we have here in the Bahamas, we are here to serve. No matter the race, no matter where you're from, once you're here in the Bahamas, you're here to serve. And persons in Family Island have been suffering for a very long time. There are lack of physicians on the Family Islands. Some Family Islands have one physician, and the islands are so huge. So absolutely, I would consider serving on the Family Islands to assist citizens of this country.
I can see you in George Stanek's humor right now. After all, you're Nixon, right?
Absolutely.
And I know that you wouldn't work in Crooked Island, Dr. Nottage.
I would have to work in Crooked Island. That's where my people are from.
Okay,
That's where the Nottages are from. Although I do have one caution. working in the islands. I hear that the food is extraordinary and very good, and so I'm worried that I'm going to go to the islands and blow up
I
like
see.
a huge ball because I'll be eating everything.
Well, let me ask you, doctors, we hear a lot about our educational system here in the Bahamas. Now, I know some of you have been privileged to go to private schools, but in your case,
I went to Donald Davis.
you went to Donald Davis and did extremely well. And I'd like for you to speak about our young people in the Bahamas and whether or not they are embracing the system of education that is provided, because you all have done extremely well. Speak to that.
Well, let me start off with myself. Going to Donald Davis and the area that I grew up in, I had a lot of peer pressure. I could have gone the other way. But at the end of the day, if an individual decide on what they want to do, they decide to make a difference of their lives and do not let the fact that wherever they're coming from determines where they will end up, they can be successful. And it doesn't matter on which school you attended, whether it's private school or public school. It's a decision that someone has to wake up in the morning, look at themselves in the mirror and say, I want to be different, I want to do this, I want a better life. The education system, we have a great education system, but it has to be, the individual have to decide that I'm going to be disciplined, I'm going to apply myself and do my work and become a productive citizen of this country.
Discipline is the word, isn't it, Dr. Knowles?
Yes, it is. And as he was speaking, I was just thinking that that is exactly it. You know, students just need to apply themselves. The educational system is great, you know, and I'll just take an example. You know, when I left high school, went to COB, and I went off to my school in the States, you know, everybody was just really impressed that, wow, you know, you're at this level. And, you know, and I'm thinking to myself, because we have a great educational system at home, you know, in the Bahamas. And I think if the students just embrace it, we have so many young people that have so many dreams and aspirations. And once they get that encouragement from their family, you know, from even the people within the educational system, I think they can do well. You know, the government of the Bahamas has done well in terms of offering students great education.
And COB has a great reputation, doesn't it?
Yes, it does. Yes, it does. Being an alumni of COB myself, it is great. You know, it has a good reputation. We have put out some excellent persons into the society.
Well, Dr. Nottage, you were supposed to succeed based on the schools that you attended, right?
Well, that is true. A huge investment has been made in my education by my parents, to whom I'm eternally grateful, of course. And my mother always told me that they can take anything away from you, but they can't take your education. So be sure to pay attention to it. It is something that your parents or you yourself, your family has invested in you. It's something that has no monetary value. It has an intrinsic value because it's something that you keep forever. So your education and what you have in your heart, your dreams, those are your motivators. You know where you want to be in life, you know where you want to end up. And so you write your story.
Yes, yes. And you've all taken advantage of the system of education, the opportunities that you had before you. And you are all inspirations, I would say, to thousands of Bahamians who are watching this program, who are listening to you today. We have a problem, as you said, Dr. Nixon, of indiscipline in the Bahamian society, particularly among young boys, young men. And there are some young women too, Dr. Knowles and Dr. Nottage. As you continue to inspire them, they look at you as being a physician now, but they can be the best that they can be in whatever they choose to do. And I'd like for you to speak to the need for inspirational leadership in the country and mentoring as well.
You know, I think, I'm going to start back. I think discipline starts in the home, in the beginning. you know, it takes the parents. They play a big part in helping students and children become what they're going to become later on. I think that we have a lot of leaders in our country now that are good mentors. I think as a medical professional, one of the things that I do want to do as I move forward is, you know, go back into the classrooms, go back into the primary schools and the high schools, and let these young people know that, you know, they can do it. Once they put their mind to it, once they really study, they can become whatever they want to become.
Mm-hmm.
You know, that is one of the things that I do want to do.
Very good, very good. I don't know if you both want to add anything to that?
I would like to add that I believe for the most part, young persons, all that they need is somebody to constantly be in their ear, encouraging them and telling them, you know, you could do what you could do, could become successful. Do not allow peer pressure to deter you from doing what you want to do.
And just to say that I think that the Bahamian society is disciplined and can be disciplined. When I was growing up, I remember thinking that we're very disciplined people, but we fall down where we don't follow discipline with encouragement. You have to encourage young people, because if you're just disciplining us all the time, we become discouraged, we don't believe in ourselves, we don't think we can become anything. So encouragement is so important. As Dr. Nixon said, you must follow the discipline with the encouragement.
Very good. Dr. Nottage, Dr. Nixon, and Dr. Knowles, thank you so very much for being here today. We are going to continue our discussion here on Jones and Company by speaking with Dr. Cornish and Dr. Brennen, two new graduates of the UWI program as well. We take this break, we'll come right back.